All right, it looks like we are live.
Mm.
Hi, everyone. It is so good to
Hi.
be here today again, here for another episode of Candid Conversations. And this is going to be a really good one. I mean, every episode of Candid Conversations is just mind blowing, at least for me personally, and I'm sure for so many of you. So, for those of you who have not met me, I don't know where you've been. I'm Dr. Funke Apolabibra. I'm the founder of Restful Sleep MD and the Restful Sleep Place. And our mission is simple. It's to help individuals, including families and their children, change their relationship with sleep so they can thrive and reach their fullest potential. And one of my most favorite things to do is to bring incredible guests on this platform where we talk about just all things around health, wellness. Of course, we always work sleep into it somehow, right?
Mm-hmm.
And
Yes.
really, our mission is to empower you with the information you need to move the needle forward and hopefully improve your sleep, of course, but
Mhm.
improve your entire health and wellness journey. And so I have an incredibly talented expert here who is also my friend, and she has done just some amazing stuff. Like, she's one of those people you see on Instagram, and you're just like, okay, I'm just gonna go on the treadmill and walk for 30 minutes right now, right? Like, so I have the incredible Dr. Alicia Shelly here. We've been friends for a while now. She has been such an inspiration to me. She's done so much work within the wellness space via weight loss. And we're going to be hearing stories. We're going to be hearing, tips. And she's been on media multiple times, TEDx, all kinds of things. She's a two times TEDx speaker. Or am I wrong? Is it more, Dr. Shelley?
No, 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 just two, just two.
Oh, just two. I beg your
Just two.
pardon. She's been on CNN. She's been featured on so many media outlets because of the wealth of expertise that she brings. And so we are delighted to have you here, Dr. Shelley. Can you tell us a little bit about who you are, what you do, and then we'll take it from there.
Yes. Thank you so much for having me on Candid Conversations. I'm excited to be able just to chat a little bit about obesity. My name is Dr. Alicia Shelley. I am the host of the Back on Track Achieving Healthy Weight Loss podcast. Also, I'm a internal medicine, primary care, and obesity medicine physician in the Atlanta area in Douglasville, Georgia. And I love helping people, number one, to achieve a healthier lifestyle. And so I have struggled with my weight, still struggling with my weight, I would say, and since childhood. And so this is something that I struggle with. And so there are many people who are in the same boat, and I'm just happy to have this opportunity to speak a little bit more about how to have a more healthier lifestyle. Mhm.
Thank you for that. And I think what I love about your journey is you are showing us
Mhm.
what it looks like to stay committed, but also showing us that it's not a walk in the park. And I think that is what makes you so relatable. And that's why we're
Mhm.
constantly cheering you on. Oh, by the way, she didn't
Yes.
mention it, but she's done like Iron Man, like all kinds of things. All sorts of wild, intense, amazing things, really taking us where we feel like, oh, our minds feel like it's pulling us back. You go there and you really push the boundaries. And I think that's just amazing. So, where do we even start? So maybe we'll start with your own story. Maybe let's start with that and how,
Mhm.
your experiences and your story really brought you to this place where you now help others to achieve healthier lifestyles and healthy weight.
Oh, yeah. Yeah. So, like I was mentioning, I started off as a child battling with my weight. I would, you don't understand things as a child. You know, you're the largest child, but the
Mhm,
kid in the class. Not only was I tall, but I was chunky,
mhm,
all the above. And so I would do different things. I'd go riding my bike. I'd be consistent. I'd lose a little bit of weight, and then it would come right back. And so I found this to be like this yo-yo type of diet where not diet, but just kind of yo-yoing in weight where I would lose weight and come back, lose weight, come back. And it came to a head after residency where I looked at myself and I was at my highest weight. It was like the stress from residency and medical
mhm,
school had just taken its toll on me. I mean, I was just getting up and going to work. Like there wasn't time sometimes to eat properly or even exercise. And I got into my highest weight afterward, and I realized that I needed to do something. So I underwent bariatric surgery and did a gastric sleeve, and I was able to lose weight. I lost about 80 pounds. I looked great, but then several years later, that weight started creeping back up, and I'm like, okay. I mean, you went and you did
Mm,
surgery. Like, oh my gosh, you did
mm,
surgery, and now the weight's coming back up, and you're like, well, what else could I do? And I realized that it kind of hit me that this has to be a lifestyle. This is not just something that you do, for a week or 2 weeks. It's something that you do on a daily basis. And so I started focusing on different things to kind of help me with making it a lifestyle. So prior to 2016, I was not a runner. Like I know we talked about doing an Ironman, but I was not a runner. I remember talking to somebody about them doing like running the 10K that's really big here in Atlanta, and I was like, "You do what? You run 6 miles?" I could not fathom that people would run this long. Like I just was just blew my mind. And so, and then she's like, yeah. And then so one day my friend invited me to do a 5K. And I was like, oh my gosh, I did a 5K. Like I was so thrilled. I couldn't believe I made it to the end. And I was like, well, maybe I'll try 10K. And then I just trained and trained. And before you knew it, I did the 10K, I did the half marathon. And then I was like, okay, we only live once. Let's do one marathon. And that marathon, when I tell you, it actually made me fall in love with running, because it
mm,
wasn't the fact of the race, it was the fact of the training for me. Like I
mm,
had to be a different person in order to finish that marathon. And it was amazing. And so I realized that this was something that I needed to incorporate into my lifestyle. I have attempted multiple Ironmans, and I actually completed an Ironman 70.3 to 70.3. And so, which is amazing. Like that was a totally another different challenge for me
mm,
to do an Ironman and triathlon. And an Ironman is for those that don't know what an Ironman is, it's a triathlon where you swim for 2.4 miles, you bike for 112 miles, and then you run 26 miles. And so my last attempt was this September. I got all the way to mile 19 on the run. I had 7 miles to go, but a technicality made me kept me from finishing. So
wow.
needless to say, I was so close. So in a couple years, I'm gonna try. I'm giving my body a break today, but then this year, but then the next year or 2 years from now, I'm gonna try it again. But still, it's amazing. I digress. But just for those who are like thinking to themselves, like, oh my goodness, I could never do something. Never say never. You may find you start small, you kind of work your way, and before you know it, you've developed this lifestyle. And so now I utilize the exercise as one way how I kind of maintain my weight, as well as with medications. Because I didn't mention this, but even after doing the bariatric surgery, I started gaining weight again. And so I realized that for me, obesity is a chronic disease. And for me, it's genetics. My body wants to be a higher weight, does not want to be a
Mm.
smaller weight for some reason. And so I have things in my toolbox to kind of help me with maintaining it.
I am so looking forward to that because a lot of
Mhm.
times the focus has been on weight loss using diets, which of course
Mhm.
that's a very critical piece of it, as well as exercise. But you've said something I'm hearing recurrently. One is surgery, that there's surgical
Mhm.
treatments and medication. And I really want us to delve into what's in the toolbox, just
Mhm.
so that folks that are hearing this can know that they don't have to feel stuck. They don't have to feel like they're victims to this condition. And one of the
Yeah.
things you said was obesity is a chronic condition. So maybe what we could do is maybe step back a little and shed some light into that, because I think there's a lot of shaming around obesity, right? People, you see someone who is on the heavier side, and right away you think, oh, they just don't have self-control, and it's heartbreaking, or they don't have
Mhm.
self-control, or they're just not, they're too lazy to exercise. And it's
Yeah.
heartbreaking. Like, oh, you're the one that put yourself here because you wouldn't do X, Y, and Z. And I know without a shadow of doubt, because I have loved ones, I have, very close friends who are on it all the time, and it's
Hmm.
just not coming up. So maybe shed some light to that, and then we can move on to talk about what are the resources, what are the tools people can utilize, starting from the basics, of course, and then moving upwards.
Oh, yeah. So, the basics that we have to realize is that obesity is similar to like high blood pressure as far as a chronic
Mhm.
disease. So, if somebody has high blood pressure, we don't shame them for having high blood pressure. It's like it's what they have. And so, and with obesity, it's a chronic disease. There are many, many reasons why people gain weight. It's a multifactorial neurobehavioral disease where it can be caused by genetics, it can be caused by the environment, the cultural, neurobehavioral, like depression or anxiety, medications. It can be caused by endocrine factors, like having a condition like hypothyroidism or even PCOS. So it could be caused by immune factors. So many different
Mm.
factors that play a role in causing somebody to gain weight. We used to, we used to think that it was just due to willpower, like
Yeah.
you were saying, like, oh, you need to exercise more, you need to eat less. But I have patients who've been on multiple diets and still not be able to lose weight because their cause of weight or weight gain is due to something else. And so we need to have, like you said, have compassion, because sometimes we feel like, oh, they're not doing what they need to do. But we need to have compassion because you don't know what people are doing in their homes. You don't know that maybe they're trying to starve themselves so that they can lose
Yeah.
weight, or they're doing different diets. And I think in being in this role as an obesity medicine physician, I've had the opportunity to meet people and then share what they're doing and be eye-opening the fact that eating has become such a challenge for them because of just the shame that they've gotten from their family growing up. And so it's important that we put away the blame and the shame and just be supportive to people as well. Um, like I mentioned before, it is multifactorial. And with that being said, there are several tools in the toolbox that we use to help manage obesity. The first one is the foundation of obesity management is the lifestyle changes and lifestyle interventions. And so usually this is started for an individual with a BMI or a body mass index of 25 and higher, where we would recommend for them to make some of these changes to look and see, hey, is there anything we can tweak to help with weight loss? If somebody has a BMI of a 30 and higher or 27 plus a weight loss comorbidity like high blood pressure, diabetes, sleep apnea, high cholesterol, then they would be indicated for weight loss medications. And so there's definitely multiple medications that can be utilized, pills, injectables, and I can go into that a little bit more detail a little bit later on. But that too is an option for people living with obesity. And then third, you have your bariatric surgery. That's indicated for individuals who have a BMI of 40 and higher, or BMI of 35 plus a weight related comorbidity like the high blood pressure, diabetes, and so forth. So usually those are what we have as far as tools in our toolbox. And it really depends on where you are. Not everybody is ready to go under surgery. Sometimes, they just want to start with the lifestyle changes. When we look at the percentage of weight loss between these different areas, usually lifestyle change interventions are usually 5 to 10%. When you
Mm.
look at the anti-obesity medication, that weight loss change is between as little as 5% as well to as high as 20, 26%, um, depending on the study that you look at. And then also with bariatric surgery, now we're getting into the 30, 20, 25 to 35 percentage of your obesity weight. So it just depends on kind of where you are, and what is best for you. So it is individualized to the person.
Mm. Yeah, thank you so much. And I want us to really go a little bit deeper with this, but I want us to come back
Hmm.
first. One of the things you talked
Hmm.
about is the causes are so different. There's such a wide variety of reasons why, you might be struggling with obesity. And I think that is so important because if you have a reason that's central in origin, one of the things you talked about was, for instance, if you have a thyroid condition, and
Hmm.
someone tells you, oh no, this is the best weight loss regimen, this is the best diet you need to get on, and you don't speak to, your doctor to say what could be going on, then it's like you're just working against yourself pretty much, because
Hmm.
then if it doesn't work out, like you don't lose the weight, you start to work, it starts to affect your mindset because you feel like you failed.
Yeah.
But then if it's a reason that's beyond you, then it's not your fault. So I think that is so
It's
important.
true.
And I'm just going to reiterate that we need to
Hmm.
show empathy and see this as a true condition. And even for pediatrics, right? I take care of
Yeah.
children who are
Hmm.
struggling with weight issues, and that tends to impact their sleep, and things like
Hmm.
that. And you can
Hmm.
tell there's actually genetic conditions that predispose you to obesity. So
Yeah.
we have conditions like Prader-Willi syndrome. We have things
Hmm.
like, we call it central hypoventilation. There's so many
Hmm.
reasons why. And that's why it's important that you speak with your doctor. There's a workup that needs to be done. And then from there, we can move on to say what treatment, because the treatment will be driven by what the cause is. I mean, yes, there are
Hmm.
some people where we need to cut back on, the intake. We need to, get on the treadmill. Yes, absolutely. But then there are others where we need to, like you said, sort of step things up a little. And
Yeah.
one quick question I had, which is, you know what? This is candid conversation. Let's be candid about it. Sleep,
Yeah.
sleep, sleep. How does sleep come
Hmm.
into it? So,
Ah.
you
Yeah.
know,
Hmm.
I want you to just tell us a little bit about that person who has said, okay, now I'm ready to lose weight.
Hmm. Yeah.
How does
Yeah.
how does sleep loss or poor sleep impact that weight loss journey?
Yes. So sleep is extremely important. So we would not be candid conversation. We would not talk about sleep. Um, and the reason being is that when you're getting less than 5 hours of sleep,
Mm,
your body is responding to that. It's increasing your hunger hormone, which is called ghrelin, and reducing your leptin hormone, which is causes you to feel more satisfied. So what does that equal? It equals somebody who's hungry. Because you're more hungry and you're less satisfied, so you're eating what's available, and you're
mm,
trying to stay awake, so you're just eating something just to keep you awake as well. And
mhm,
so on top of that, studies have shown that your BMI starts to increase as you get less sleep. So
mm,
it is extremely important that you are getting enough rest on a daily basis. You have to prioritize it. You're never going to get enough sleep if you don't schedule it and you make it a priority in your life. But it's super important that you get that in, especially if you're trying to lose weight. And so when I am counseling my patients, I'm asking them, how many hours are you getting? Is there a way we can improve this? Because they need as much sleep as possible in order to get them to their goal weight. Mhm.
mm. Thank you so much for highlighting that. And actually, there have been studies now
Mhm.
that they have looked at weight loss as kind of part of the
Mhm.
intervention for, I'm sorry, better sleep as part of the
Mhm.
intervention for weight loss, and compared it
Mhm.
with those who they just said, you know what, whatever, continue the regular sleep habits that you've typically followed. And
Mhm.
in terms of the other core interventions, nothing else changed. So it was the same
Mhm.
diet, the same exercise regimen, the same limited calories, the same everything. But the only difference was sleep. They
Mhm.
provided
Yeah.
one group with like sleep hygiene tips, they put
Mhm.
them on a sleep schedule, and there was a dramatic difference between both groups.
Wow.
So even in terms of what you said, in counseling
Yeah.
patients, losing weight,
Mhm.
and getting adequate sleep really go hand in hand. Thank you so much for really shedding light on that.
Oh yes, yes, no problem. I'm so glad. So everyone out here, you heard it from the master, from the expert. You need to get your rest if you're trying to lose weight.
Oh man, yeah. All right. So now you mentioned some lifestyle factors, based on
Mhm.
the level of the BMI. So maybe we could talk through what are some of those lifestyle factors that we can consider incorporating to help with weight loss.
Yes. So there's definitely several strategies or five pillars we should be looking at. So the first one, of course, is going to be what we mentioned, the diet, right? What should we be
Mm,
putting in our bodies? Now, when they looked at all the different diets that are out there, the keto, the South Beach, the Atkins, the paleo, the plant-based, what they notice is that people lose weight. So you'll lose weight with any diet that you are
mm,
on, but the question is, can you maintain it? That
mm,
is the key. So it's important to choose a lifestyle diet that works best for you. That's something that you enjoy and something that you can maintain. So
mm,
if you don't like meat, then the paleo diet is not your diet, or the keto diet
mm,
is not your diet. You need, you would be more apt for a plant-based diet. Now you can still do a plant-based diet with higher protein, but you just have to be more creative with it. So it's
mm,
trying to find something that works best for you. Now, if you have uncontrolled diabetes, then maybe the keto diet or a low carbohydrate diet is best for you. So choosing a plan that works best for where you are in your lifestyle, and if what medical conditions you have as well. The other thing is when we look at processed versus unprocessed foods, what we find is the less processed the foods are, the more weight you'll lose. I don't know if this ever happened to you, but I would go overseas where they just process food differently. And I'd be
mm,
so surprised that I lost weight while on vacation
mhm.
because I wasn't tracking, I wasn't writing nothing down, but I was
Yeah.
eating food that was just less processed. It was kind of that farm
Mm,
to table type food where,
mm,
they do what they need to do, but it's not, there's no middleman. And so it's
mm,
important that when we look, and if you looked at different documentaries like Super Size Me, and where you see this guy that just ate McDonald's for so many months, and you could just see how like his body just transcended. Not only did he gain
mm,
weight, but his cholesterol went higher. So these processed foods are making it more convenient for us, but they also can play a role in us gaining weight. So it's
mm.
important to kind of eat less processed foods, making sure you're getting your vegetables, your fruits in on a daily basis, because that will help with losing weight. The second thing I would say, definitely mention this, is with that physical activity. A lot of us think that we have to do some crazy activity where we're going to the gym, we're spending hours and hours in the gym, and so it's just like it does not have to be that way. It's important to find time, things that you enjoy doing that helps you to stay active. And it doesn't have to be at the gym. You may enjoy swimming, so you go swimming. You may enjoy walking your dog, so you walk more of your dog. You may enjoy just spending time with friends and you go for a run. Whatever it is that you enjoy doing, this is the best time to, when you think of exercise, it's the best time to incorporate it. So for general health benefit, it is recommended that you exercise 150 minutes per week with 2 days of strength training. But if you're really trying to lose weight, then you really need to get at least 200 to 300 minutes per week. So that physical activity is important. We talked about sleep being important. And then the last thing I want to just mention is the stress piece. Stress can actually increase your cortisol levels, which can lead to more fat deposits. So especially chronic stress. So it's important that we have ways that we can actually manage our stress and to help us with, reducing our stress so that we have less of that cortisol in our system. So those are just 5 pillars that we need to consider when we're trying to lose weight and incorporate more lifestyle interventions.
Thank you so much. I love how succinct it was. And this is like the whole package, really nicely tied up in a bow. There's diet, and the diet, there's no perfect diet. Same way I talk about sleep, there's no perfect sleep routine. There's no
Yeah,
perfect
yeah.
diet. The
Mhm.
perfect diet is the one that works for you and that is sustainable, because
Yeah.
every diet works. So I think that is so important. And thank you so much for highlighting that, because people might be
Yeah.
thinking, oh, it's because I couldn't do the paleo, that's why I'm having a hard time, or I couldn't do the plant-based. And no, that's not
Mhm.
the issue. The issue is, what are we doing with sustainability? What are we doing with
Mhm.
navigating and making sure that the things we still enjoy, right? You don't want a diet where your
Yeah.
heart's racing, you feel nausea, and you're
Mhm.
like,
Yes.
I hate this so much, and you're stuffing your nose just to try to push it down. No, you still want to enjoy food is meant to be
Yeah.
enjoyed, and you can still enjoy healthy, wholesome foods that will be nourishing to your body and that can help you with your weight. And then the
Yeah.
second piece you talked about was the exercise. And I love that as
Hmm.
well. I love the fact that you're not putting people in a box. You're not saying, oh, you
Oh yeah.
must do this. Iron Man, like I'll be there all day, every day to cheer you, girl. I am not not just because I can't inspire myself or be motivated enough to do it. I don't just think I want to do that, right?
Yeah, yeah, yeah.
And that is
It's not for
fine.
everyone. It's not for everyone. No
Exactly.
worries.
And that is beautiful, right? It is beautiful.
Yeah.
It's incredible to watch people like you do that, and amazing.
Mhm.
But you don't have to. You don't have to feel like, oh man, I can't run a marathon, so I'm screwed. No, 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 no. What can you do? What can you do? Up and
Yeah.
down the steps, walk a dog, walk around the block, whatever,
Yeah.
movement. And thank you for providing those limits, 150 minutes a week. We can find time to do that. Now,
Oh
can
yeah.
I just ask for a friend? That's
Mhm.
2 days of strength training. Is it in addition to the 150 minutes or can we put it within? Okay,
Yeah,
hallelujah. Thank
it's
you.
yeah. Yeah. Yeah, no
Perfect.
worries.
Okay, good. So
Mhm.
training is so good. I
Mhm.
started doing that at the beginning of the year, and I can
Mhm.
feel it in my body that it's definitely making
Oh
an
yeah.
impact. And then sleep, of course, we already talked about
Mhm.
sleep. I mean, we could do a whole
Mhm.
episode on sleep, but we're gonna do that
Yes.
some other time. And then the stress management and that link between, cortisol being chronically high, and
Mhm.
poor sleep will increase your cortisol level. Stress will
Mm.
increase your cortisol level, and increased cortisol level will lead to increased fat deposits, and it's going to be hard to shake all that off. So we can see how
Yeah.
this really ties in nicely. Thank you
Mhm.
for, did I miss that? Anything? Diet, exercise,
No, you
sleep?
had it all.
Yeah, yeah.
Yeah.
Awesome, awesome. So how about
Mhm.
medications?
Mhm. Yeah, so definitely it's important to talk with your doctor about medications. So, like I mentioned earlier, we have pills and we have injectables. Right now, the most common medications that we use for weight loss are going to be your Adipex or phentermine. This is a stimulant. It kind of gives you a lot of energy. It kind of allows you not to feel as hungry when you eat to help you feel full. We have Quasimia, which is a low dose phentermine as well. It has a phentermine in it that we use that has a combination of phentermine and topiramate, and it's very similar, but just has less of the side effects. And then you have Contrave, which helps with at the level of the brain to suppress your appetite. And then we start to get into our Wegovy and Zepbound. So Wegovy is a injectable, once weekly injectable that helps with suppressing your appetite. It helps you not to feel as hungry. It kind of delays gastric emptying, meaning that it slows down the stomach. And then Zepbound, it actually is very similar, except for it kind of targets two hormones instead of one. And then also the studies show that Zepbound had a little bit of a higher weight loss. Now we do have a daily injectable called Saxenda, which is once a day. You would use that medication for that. And with these medications, they are there are I mean there are others. Well, no, sorry, we have other off label medications that aren't necessarily labeled for weight loss that we do use, but these are kind of the core ones. Right now, the Saxenda and the Wegovy are on back order, so it makes it kind of harder to
Mm,
find. And that has been the biggest frustration, I would say, with my patients. Ultimately, it's important that you see your doctor and they decide kind of which medication is best for you and which one you should will be successful with.
very helpful. So how do you, I mean, with your patients, granted, this is not
Mm-hmm.
something you have to speak with your own doctor to know because everybody's condition
Mm-hmm.
is different. How do you decide
Sure.
which versus what? Bearing in mind what
Mm-hmm.
you said, like the Wegovy, Saxenda, those the
Yeah.
injectables, one, they're expensive and they've been become very, very popular. And and I know you've been on so many media outlets talking about this and really
Yeah.
enlightening the nation pretty much about
Mm-hmm.
how this works. So how do we decide which is for our who gets what?
Yeah. So a lot of times it's insurance, right? Because
Mm,
so insurance will dictate what is what they cover. And so we have to, work within line. But if you're paying out of pocket, then we have options. We can try the oral
mm,
medications first. Sometimes the insurance wants you to try the oral medications first before they even approve the injectables. And so just you have to talk with your insurance what they cover. The other thing is for the patients, what we're finding with Zepbound and with Wegovy, they have a higher weight loss than the pills do. So they would be they're not necessarily in the guidelines, number one, but definitely that's one of the ones I try to get people on because number one, it won't mess with the heart, it won't mess with the blood pressure. It'll help reduce your blood pressure, if anything. But they tend to the injectables tend to lose more weight. So it is, I do find with my patients that they have more success with that. So that's why I tend to go with the injectables
Mm,
first, if insurance covers it. But that's, if they don't, then we're back to the drawing board.
mm. That is just so unfortunate. It is so
Hmm.
sad that the care that patients receive is driven by what the insurance company decides, right? And
Yeah.
but
Hmm.
that's again, that's a story for another day, I guess.
Yeah.
One thing I wanted to highlight, we're getting some incredible comments here. So amazing and thankful. First of all, I can see that Sophia Anong said, "You are just such an inspiration." She's running a 5K in April. So good luck to that. Good luck to you, Sophia.
Yay! Congratulations, Sophia.
Yeah. And then Ma said, mindset and body image. And she is an incredible body image,
Hmm.
body confidence coach. She said
Hmm.
the body image, perception, and mindset are very important pieces of that weight loss journey because sometimes our minds don't always catch up with the transformation that our bodies are undergoing. So we need to do some mindset fitness to help. And I think that is so powerful, right?
Yes, yes. Our minds, especially because, like I mentioned, we've been taught a certain way on how to look at our bodies, but sometimes it's not the most helpful and not the most positive. So I think it's
Mm,
important that we have more mind body resets on
mm.
how we look at it. So I
Yeah.
agree with her.
Yeah, I love that. And that
Mhm.
actually then helps in terms of what we need to do to maintain, what we need
Mhm.
to do if we need to pivot. Like if you have that mental fitness in place, then it really does help you say, okay, this is a condition. Maybe what I used or what was tried didn't work. Now, how would we shift without feeling like you are the one that failed, really? So I think that is so powerful.
Yeah.
Now, we've talked about so much. I'm just really mind blown. I'm just so just excited about this. I think
Yeah.
one thing I wanted to mention is, or ask actually, is you talked about sometimes, like, if you're doing bariatric surgery or needing the medication, you're actually also considering those comorbidities, right?
Yeah.
So maybe what we
Hmm.
could talk about really, really briefly, I mean, this has been so powerful and
Yeah.
educational, is what are some comorbidities that we see that happen with obesity?
Yes. So there's been over 200 medical conditions
Wow.
been associated with obesity. So and we're talking not just the sleep apnea, high blood pressure, type 2 diabetes, but even the risk of cancer, specifically
Mm,
female cancer. There's an increased risk, about 44%, in individuals who are living with obesity in comparison to others who are not. So, and these are your female cancers that are at increased risk. So that is a difference as well. Also, fatty liver. The fatty liver can actually turn into cirrhosis of the liver, or end stage liver damage because of the excessive fat that's been stored in the liver. And then, of course, but not least, is these joint pains, osteoarthritis that has worsened when you
mm,
have extra weight. I mean, how many of us wake up and we're like, "Oh, I'm so stiff. What is going on?" And it's, that you realize that little extra weight there that makes a difference. He may just be stiff
mm,
anyway, but it just happens. So that
mm,
makes a difference as well. So these are just a few of the conditions that have been associated with obesity, that have, really can play a role on people's mortality and morbidity, and just their overall lifestyle. Um,
mm,
lifestyle, I can say the process lifestyle that they have.
mhm. Yeah. Thank you so much. And then I also
Mhm.
want to add sleep apnea.
Mhm.
So sleep
I
apnea is
sleep
that
apnea too.
condition where you have pauses in your breathing. And we've
Hmm.
seen that obesity is a very it's a high risk, it's a risk factor for sleep apnea. And
Yeah.
so you may find, because of that excess weight around the neck, on the tongue, around that airway, it makes things more narrow. And so when you go to sleep and things relax, it's going to create
Mhm.
that opportunity for obstruction. And we don't want that,
Yeah.
because when you have sleep apnea, then your sleep is fragmented such that even if you're getting enough quantity sleep, the quality is poor. And so what that can actually lead to
Mhm.
is more obesity. So then we have this vicious cycle. And so really that's a time when we aggressively also want to treat sleep apnea in patients that are struggling with obesity, because it can affect their ability to lose weight.
Yes.
Yeah.
Oh yeah. Absolutely.
Yeah. Now,
Mhm.
someone asked about OTC, over-the-counter
Mhm.
medications. What are your thoughts on that for weight loss?
So I haven't seen them to be as
Mm,
helpful. To be honest with you, I mean, they don't. When we look at the over-the-counter weight loss medications, what comes to mind, the keto gummies or the
mhm,
berberine, some of them can help with curbing the appetite, but
mm,
I'm not seeing a significant weight loss with them. The
mhm,
problem is that a lot of times with these over-the-counter medications, they're not studied, so you
mm,
don't really know how much weight people lose. You just have people's anecdotal review that they
mm.
mentioned. And so, but we look at it for a lot of times, you really haven't seen as much weight loss with them as if you would with medications.
Okay. Thank you. That's very helpful. Well, let's wrap up. Otherwise, we're going to keep you here. There's so much stuff. I feel like we're going to have you come back again. But
Yeah.
now you've shared so much.
Mhm.
And again, we highlighted some of the work you've done, some of the work you're doing
Mhm.
currently. But where can people find you to learn more if they want to work with
Mhm.
you? And I know you are a speaker, a keynote speaker, an educator, and you work with the media. So can you just tell us all of that stuff so people can learn more?
Yes, you can find me on Instagram, TikTok, Facebook at Dr. Shelly MD. I'm all over. You can also, if you want more information, feel free to join me on my podcast at the Back on Track Achieving Healthy Weight Loss podcast. You can find that wherever you listen to your podcast. We have great guests and hosts and people that come on and just share their knowledge. And then you can just go to my website at drshelleymd.com and I'll be happy to share more information with you. I hope you all had a wonderful time today. So thank you.
Yeah, no, thank you so much. And I've
Mhm.
put that in. It'll also be in the notes, and it's been just so enlightening. Thank you for sharing your time. And and that's it. Well, one thing I want to tell you guys, you've been here with us this long, and we've talked about a lot of things. We've talked about weight loss, we've talked about how sleep impacts weight loss, and we've also talked about what to do. So I'm just
Mm,
going to invite you to really sit back and say, what
mhm,
one step can I take towards achieving that healthy weight, right? And
mm,
that healthy weight is not a perfect number, it's what makes you feel good. And so
mhm,
this is a place where you can lean in with curiosity without any judgment to say, what do I need to do? What's that one thing I need to do? Do I need to reach out for help? And as you explore that, or whether you're not, whether you're someone who stumbled upon this episode and
mhm,
you're struggling with sleep, or someone, you have a child who's struggling with sleep. And what does that mean? Difficulties falling asleep, staying asleep, and it's affecting your function. It's affecting your weight
mm,
loss journey. It's
yeah,
affecting that motivation you need to run, or maybe not run a marathon, but just get out of bed and, and get on the
mm,
treadmill.
yeah,
Or impacting the kind of choices that you're making when it comes to your diet. Sleep is so
mhm,
fundamental, and that's where we come in at the Restful Sleep Place. So we provide services, sleep services. Think helping you feel well rested when you wake up in the morning, helping you fall asleep and stay asleep, dealing
mhm,
with those pesky night wakings, helping your child
yeah,
sleep better. We provide these services to children, young adults, and their parents who have sleep issues, and we would love to help you. We're accepting new patients if you're in California, Pennsylvania, or New Jersey. We have telemedicine services, we have in person services, and
mm,
we would love to be part of that restful sleep journey. Our phone number to schedule an appointment is 215 607 8297, or you can go right to therestfulsleepplace.com to schedule an appointment. And you know what? That's what we're here for. We're here to empower you so you can make the right choice, but also to help you close the loop to say, we're here to help. so that that right choice is one that's sustainable, that works for you, and helps you to be the best version of yourself. Thank you again so much, Dr.
Thank
Shelley.
you.
I'll see you around, okay?
All right. Thank
Bye.
you. Thank you so much.